that we have the tools, we have the data, and we have the information that industry will be able to implement that standard is equally important. And that really then brings us to this agenda in terms of what needs to be done and how it will be done. I have 4 outstanding speakers for you today. I have my colleague Rajeshwari Sinha, who has been working on these issues, and I will invite her first to make the presentation. I then have Ed Top. Ed is the principal research scientist with the Agriculture and Agri-Food Canada, and he has an affiliation with the University of Western Ontario and the Veterinary College there. So he really can help us to understand the interface between agriculture, human, and environmental health. Steve Brooks. Steve is the advisor to the Antimicrobial Resistance Industry Alliance and chairs the manufacturing work group of the Alliance. And this is critical because, as I said to you, one of the major areas of concern is the manufacturing sector. But what then is industry looking at and how do we move forward is critical. The 4th speaker is Sheikh Ahmed. Sheikh is an associate professor at the Department of Biochemical Engineering and Biotechnology at IIT Delhi. And he has over 10 years of experience in the field of environmental technologies and has worked very closely with a number of companies. And he will really speak on the issue of the importance of low-cost, affordable waste management technologies when it comes to containment of AMR. So as I said, a very, very interesting group of speakers. I'm hoping that we will have time for Q&A. Please post your questions in the Q&A rather than the chat box, because it makes it easier for me to manage. Otherwise, I'm sort of jumping between the 2 boxes and getting lost. So I'd be grateful if you would pose your question there. And I'm going to ask all speakers to keep their presentations or their talk to 10 minutes, starting with Rajeshwari. Please, Rajeshwari, the floor is yours.
Thank you, Sunita ji. I will quickly share my slides. Okay. Good morning, good afternoon, and good evening to everyone who has joined us for this webinar. I'm Rajeshwari and I work here at CSC, and today I'm going to briefly maybe set the context for the discussions around AMR's linkages with waste from farms and factories. It has been a week of awareness, and I think by now we all understand how important and how multisectoral is the issue of antimicrobial resistance. It's been contributed by from sectors which include the human health, the animal health and food animal production, crops, and waste and the environment. Today, the discussion is largely focused on waste and environment, and we are going to see what are the linkages with farms and factories. But before going forward, I think we all need to stop by and take a look at how we can, bring down this entire gamut of environmental AMR issue and structure them and see how can we break it up into point sources and non-point sources. So we could break them into farms, factories, households and community settings and healthcare settings, all potential sources of AMR causing determinants into the larger environment, which is the determinants include antibiotic residues, resistant bacteria, and even resistance conferring genes coming from these sources, waste from these sources or effluents from these sources. And when discarded with or without treatment, which may be tuned to be able to address the removal of these determinants from waste, these find their way into the larger environment, which include the rivers, groundwater, agricultural soil, which we again call non-point sources because in some way or the other, they are again acting as sources for us, for the community, for irrigation, for drinking water. So what goes in comes back, and this is a reservoir of AMR determinants. Before moving forward, I would like to stress on how the idea of intersectoral transfer is also happening. For example, waste from animal farms, particularly poultry, dairy, fish, as well as crop farms that we have seen in our studies. We see that poultry litter or manure, like has been said a couple of minutes earlier, they form a huge component of agricultural fertilizer and contribute to making the soil fertile for raising crops. At the same time, we know that these are used to grow phytoplankton in aquaculture ponds so that the fish can feed on them. It is also used in mushroom farming, as we understand. Even waste from dairy farms find their way into quite useful components in agriculture. When it comes to crop farms, when we are spraying antibiotics over them, the unspent antibiotics can go through runoff and into the larger environment. So within each sector also, within each point source also, there can be intersectoral transfer happening, and that is also adding to this reservoir of AMR determinants. So globally, where do we stand today? Where have we moved in terms of being able to manage environmental AMR? The issue has got least attention, or if I may say, it still gets least attention when we compare it to the human and animal sectors. While it is true that the scientific community is quite actively engaged on building evidence on different aspects, for example, the determinants or even the different waste streams like hospital waste, sewage, and manure. The United Nations Environment Program has been recently roped into in order to work along with the tripartite who has been leading this momentum for quite some time. We understand that a report on environmental aspects of AMR is also being worked upon in this direction. Of late, there is more traction seen on the need to address environmental AMR, in particularly waste from hotspots like the pharma industry in global deliberations, global advocacy, policy, trade and economic discussions like the G7 discussions, the Global Leaders Group on AMR. And like we also have today, the industry is also on board. It's also in the picture through the AMR Industry Alliance. But having said so, a couple of positive things have happened. Things are moving, but still, when we come to technical guidances or SOPs or frameworks, which can actually tell nations what to do, how to move forward in terms of policy, surveillance, capacity, research, that is something which is still needed. Similarly, what is needed is having more understanding on the integration and linkages between AMR between AMR and water sanitation and hygiene components. This is still less advocated for, and so is the importance of how we can prevent infections in the first place and allow the reduced use of antimicrobials. There is also all this is happening despite a recognition that what we have, evidence that we have, is enough for us to act and not wait to take action, not allow the understanding that the issue is complex, we need more evidence. These should not act as a barrier to for immediate action. In terms of the national component at the country level, we find environmental AMR aspects present in varying degrees in most national action plans today, which definitely reflects that there is stakeholder consensus and interest in recognizing and addressing the issue, which was again, lacking a couple of years back, but things have changed. It aligns with the overall mandate of preventing chemicals into the environment and focuses on multiple aspects like surveillance, biosecurity, managing waste in different plans. But still the focus required on prevention and wash is not as much as we would expect and needs more attention. At the national level, there are existing waste management policies or standards. There are biosecurity guidelines, but again, these are not largely AMR centric. Having said this, limited on-the-ground progress has been seen so far when it comes to environmental AMR management, partly because there is lack of dedicated funding within the anyways limited funds that is dedicated for antimicrobial resistance as an issue. There is limited know-how and capacity due to the absence of global guidance and the issue being cross-cutting and complex. And we see that there is over-dependence when it comes to environmental AMR on resource-intensive and technically demanding surveillance processes. And in this, what happens in this process is whatever which is achievable or cost-effective prevention approaches, for example, you use less and you pollute less, these components are overlooked. What do we have in store for low and middle income countries? Yes, there are challenges, but there is also opportunity which we need to explore. What we have heard so far tells us that the issue will need more financial and technical resources as well as time to bring things under control. But it also tells us that we need to do things differently, because as low and middle income settings, we cannot afford to pollute first and then keep on spending a huge amount of money to clean up. The cost of increased treatment due to antimicrobial resistance, or the implications it will have on livelihood and economics, is something we will not be able to afford. Besides, there is a challenge of producing more food and also the challenge of hygiene and sanitation. So what is it that we need to do? We need to find solutions which are cost effective, technically less demanding, and relevant to our local context. What makes us hopeful is that agriculture is still not as intensive as compared to developed countries, and the pharma industry is largely limited to only few countries, so it's quite manageable. It just tells us that there are opportunities. We need to leapfrog and do things differently. This is the last section of my slides, which tells about way ahead. We must prioritize and invest in the environmental AMR agenda, both at the global and national level, as part of a true One Health action. This includes doing more research, building more evidence, documenting them, advocating for the issue, calling for more funds, capacity, and action, immediate action. Just to highlight what we need specifically is to focus on prevention. Prevention could be at the farms as well as at the factories. At farms, we look at aspects like having clean water, biosecurity, alternatives, good animal husbandry, as well as vaccination approaches, so that the need for antimicrobials is reduced. At the factories, we should focus on better process controls and better monitoring approaches, so that the need for end-of-pipe monitoring or high-end expensive surveillance processes goes down. There is also a need to focus on better water sanitation and hygiene approaches. We also need to manage our waste well through an AMR-centric approach, and also see that the waste management technologies and approaches are affordable and low cost, relevant to the emerging world. Like Sunita ji said, waste is a resource for us in view from the point of view of efficiency and circularity. It not just saves costs and prevents environmental contamination, but plays an important role in the entire organic movement in pushing through the agroecological practices of LMIC settings. Equally important is building capacity, developing an important research agenda, and developing the right policy, the right set of standards, and identifying the correct hotspots, so that we are able to manage the issue well going forward. I would like to stop here and allow the discussions to move forward.
Thank you, Rajeshwari. And if I may ask Ed now, and he will talk about and explain to us how AMR in the agricultural sector and what we can learn from it. Ed?
Thank you. Can you see the slide?
Yes, we can. Can you move it to full? Yes, perfect.
Thank you. Very pleased to be with you. Thank you so much for the invitation to participate in this roundtable. I'm going to say a few words to frame the discussion around the agricultural aspects of the agriculture environment nexus. And I'm going to spend some time reiterating some of the points that were raised in the excellent introduction that Dr. Sinha just gave us. So I was asked to talk about what do we know about AMR from the agricultural sector and what can we do to contain it. So I'm going to split out agriculture in terms of terrestrial food production, aquaculture food production, and just give some concluding thoughts related to challenges that those of us who work in this sphere are confronted with, and perhaps some opportunities for mitigating the problem. So we have animal-based production systems, meat, dairy, for example. We've talked about poultry, swine in many parts of the world, bovine, et cetera. And at least in high-income countries that I'm familiar with, certainly large amounts of antibiotics or antibacterial antimicrobials are used for the prevention and therapy of infectious diseases, and in some jurisdictions, although this is now being controlled, for growth promotion as well. And we have a lot of evidence indicating that through this practice, AMR is generated in these food production systems and is transmitted to people through the food chain. As we've just heard as well, the waste streams from these farms contain antibiotic-resistant bacteria that were selected for in the guts of birds or animals, as well as antibiotic residues. And when those waste streams are used in many instances as a very valued fertilizer, there's concerns about movement of biological or chemical residues to adjacent water resources or potentially to crops that are harvested for human consumption or that are fed to animals on pasture, for example. In some parts of the world, people are in close proximity to animals. In many lower income settings, for example, you'll have households where you'll have the residents very close to the animals, and there may be a concern there with direct exposure of those people to AMR in those animals. And as we've just heard, mitigation strategies would largely be based on devising means of reducing the need for antimicrobials and therefore selection pressure for AMR in those systems, and the excretion of residues that are environmental concern. There's sort of an emerging area that I think is reaching more interest, that is now seeing more international interest, and that's plant-based production systems. And in many parts, well, crops are often have problems with fungal or bacterial plant diseases that will really cripple production. And in those contexts, there's widespread use of fungicides. In some parts of the world, antibiotics, in other parts of the world, not. So for example, not in Europe, whereas they would be in North America and elsewhere, or biocides such as copper salts. And there's now a concern that the agricultural use of fungicides is resulting in fungicide resistance, or maybe contributing to fungicide resistance in filamentous human pathogens and yeast, single-celled fungal pathogens. And so the link between agricultural and plant-based use of these chemicals and what we're seeing in the clinic is getting more interest here. Then we have aquatic-based food production systems, so whether it's shrimp, shellfish, or finfish, and many of these systems receive antibiotics directly to control bacterial diseases. And so that is raising a concern of AMR development in those environments and in the food that are harvested from those environments. And again, mitigation will largely consist of reduction in AMU through whatever technologies, practices make sense for that particular production sector. So a few concluding thoughts. Clearly, antimicrobial use is contributing to AMR in food production systems. And in the One Health context, that is of concern both from the environmental dimension and the human health dimension. Reducing AMU where possible is called for through stewardship practices, whatever alternatives make sense, diagnostics so that individual animals can be treated and not whole herds. And as we heard earlier, restricting use of antibiotics that are of particular importance in human medicine. Where possible, ensuring good hygiene in production and processing so that you don't have food contamination from the environment. A big challenge that we have in this sphere is source attribution. So clearly pointing the picture from food or an environmental matrix into humans is a challenge. And finally, there are really interesting developments in the scientific sphere. For example, sequencing and genomics tools that are going to, in the near future, allow us to have greater insights into the flow of antibiotic organisms, but also the antibiotic resistance genes and their associated mobile genetic elements through microbial populations, ultimately resulting in human exposure, and what the key drivers are that are permitting that flow, whether it's the use of antibiotics or other chemicals, for example. And with that, I'll wrap it up. Thank you very much.
Thank you, Ed. That's fascinating. I will immediately ask Steve. Steve, please. And he will talk, obviously, on the global pharmaceutical industry initiatives and what is the plan to contain AMR.
Okay, thank you. Again, it's a pleasure to be with you and to have the opportunity to talk about what industry is doing to address some of the concerns that have been mentioned in the
Steve, if you could make it full screen, please.
Oh yeah, certainly I can do that. Sure, hang on, I just got to move my little, get these images out of the way. 1 second, and here we go.
I think the one next to
Voila, it's all right, here we go. This should do it. Yep.
it's the one next. Yes. No.
Yep, perfect. Okay, so yeah, my role is with the AMR Industry Alliance, and I lead our manufacturing work group. And I'm going to just explain briefly what the AMR Industry Alliance is, and then I'll talk about the work that we're doing. So the Alliance is really leading the efforts of the life sciences industry to contribute to addressing antimicrobial resistance. Of course, no one sector can do this on their own. It requires a lot of collaboration. We represent approximately 100 companies and trade associations drawn from the diagnostic industry, the biotech industry, and then the pharmaceutical industry, both generic and innovative R&D pharmaceutical companies. And we're focused in 4 areas to address AMR, including manufacturing, which I'll talk about, but also issues concerning access, appropriate use, and research and science. So that's really focused on, of course, the drive to find new antibiotics and to make the market incentives work properly. But I'm going to talk about our efforts to mitigate environmental impact and to advance responsible manufacturing through our approach to standard setting. So just as a reminder, and I think actually Ed's done a nice job of talking about some of this through the agricultural challenges that we face. There are many sources of antibiotics in the environment, including from manufacturing facilities if the waste from manufacturing is not properly controlled, it's not adequately controlled. But also most of what is made is used, it's consumed by typically by a patient, by an animal, whether that's in livestock or companion animal, or a patient, a human patient, or aquaculture, or applied to crops, in fact. And so through all of these routes, antibiotics can end up in the environment. So we're focused here on the manufacturing component of this, so one of many sources. The issue with manufacturing, of course, is that if manufacturing wastes are not well controlled, then there can be relatively high concentrations of antibiotics in waste streams, which can be emitted into the environment in proximity to manufacturing plants. And that, of course, is a concern. And there have been plenty of reports highlighting that examples of this have occurred. And most notably, in fact, in India, where there is a very large a concentration of antibiotic manufacturers. And these reports have garnered quite a lot of traction in the mainstream media as well, calling for action. So the AMR Industry Alliance has developed 2 important work products, something called the Common Antibiotic Manufacturing Framework, which is really an environmental management system for the production of antibiotics, and what are called predicted no effect concentrations, or PNECs. These are notionally considered as safe discharge targets for antibiotics, so safe concentrations of antibiotics in receiving water. And in developing these, we'll call them, kind of industry self-proclaimed standards, what we've also done is then our members commit to meeting these standards across their supply chain, so at their own sites and at their supplier sites. And the Alliance publishes progress reports every couple of years on how our members are doing. So we've published two reports, and they're available. And I presume these slides will be made available to people, but the links are in the slides. And right now we're at press, basically, with our 3rd report. We've just issued the executive summary, so that is available online with some high-level information about the progress that the Alliance has made across all the areas that the Alliance is working in. So not just manufacturing, but importantly, it includes our progress in manufacturing. I'm going to share some data with you in a minute to give you an idea of how we're doing. And then what I'm very pleased to share with you is that the work that we've been doing in our so-called self-proclaimed industry standard, we're now working through the British Standards Institute to develop what's called a publicly available specification. So this is working with stakeholders to develop a consensus standard. We hope to have that standard published next year. And the intent is that not only will we have a standard, but that we are also going to develop an accompanying certification scheme. So what that will mean is that independent third-party audit firms will be able to become accredited to then certify that antibiotics are made in accordance with the consensus standard. And what we hope that will do is provide a high level of assurance to stakeholders that antibiotics are being made responsibly and in a way that reduces the risk of AMR developing as a result of those manufacturing processes.
Steve?
Place so that this becomes the norm. So that's what we're hoping to achieve next, and we're on our way to doing that. Here's some progress information that's in the executive summary that's just been published from the Alliance. So the good news is that the majority of our members, and there are, of those 100 companies, by the way, there are approximately 20 companies who manufacture antibiotics. So we have a lot of biotech companies that are not yet at the stage of commercially producing antibiotics in our membership of 100, but approximately just over 20 members are manufacturers, including some of the big manufacturers of antibiotics. And in fact, we represent about 1/3 of the global supply of human health antibiotics based on sales data. So we represent a large chunk of the industry, but we don't represent all of the industry, which is why we want to drive to the introduction of the standard I referred to, so that we can try and drive change across all of industry. But across our members, what I'm pleased about is that 3/4 of our members' own sites now meet the requirements of the antibiotic framework that I referred to. And in fact, almost all the sites meet the requirements, at least in part. And nearly 90% of the products that are made at those sites meet the PNEC targets. So I think that's a really significant progress that we're able to now report. All that said, our work with our suppliers is still a work in progress. And we have more work to do to seek to influence suppliers. It's sometimes not quite as straightforward working with suppliers. And some of our supply chains are very complex, very large and very complex. So here's where we stand at the moment. About 86% of suppliers understand, or at least we have communicated our expectations to those suppliers around meeting our framework and our PNECs. Just under half of those supply sites have now been assessed against the framework, and half of those sites meet the requirements in full. And of the products made at suppliers, 42% of the products have been assessed against the PNEC, and of those that have been assessed, 73% meet the targets. So there is progress also here with the suppliers, that it's clearly not as significant as at our members' own sites, and that will continue to be an area of focus for us. But nonetheless, overall, I'm very pleased with the progress that I'm able to report to you here today. These are the member companies who manufacture antibiotics, and you'll see that includes Indian companies, large and small. and it includes international companies with significant supply chain footprints in India. So our efforts are global, and they absolutely include India. I'd like to conclude with one more slide to talk about a project that is not run by the Alliance. I want to be very clear on this, but we are a technical advisor to the project. It's called RAMP. It's Responsible Antibiotic Manufacturing Platform. It's a public-private partnership, and the reason the Alliance is involved in RAMP is that we see it as a really good mechanism for further promoting the Alliance manufacturing standards beyond the Alliance members' supply chains. The aim of RAMP is to encourage especially local manufacturers to adopt responsible manufacturing practices. It's run by SIWI, Stockholm International Water Institute, with a number of other partners, and including some pharmaceutical companies. And it's seeking to work with government, local government, state government, especially in India, to try to find ways to encourage and incentivize local companies to adopt these standards, which, again, to go all the way sort of back to the beginning here, there are no regulatory requirements that explicitly cover the manufacturing of antibiotics in terms of their discharge concentrations. So all of the work that's been done to date is being done voluntarily. It's absolutely the right thing to do. Of course, it needs to be done, but we have to find ways to bring people along and to engage them. So we can do that through the Alliance directly, because we have direct influence through our members, but also we have direct influence with first-line suppliers. Beyond that, though, we need other mechanisms to bring people along to do the right thing. So that's why we're driving our standard, because eventually I think that will be the way forward. And in parallel, we're also, technical advisors to the RAMP project. So I think with that, I will conclude my remarks, and obviously be happy to take any questions in due course. Thank you.
Thank you, Steve. Very interesting. I think you will get a lot of questions, including from me. So I'm looking forward to our discussion. If I can now ask Sheikh to come in and to talk about the possibility of using low-cost technology for controlling this. Sheikh, please. Do you have a presentation as well? You're on mute, and we can't see you as well. Okay, I think he's probably logging back in. Must have been some technical glitch. Just let's give him a minute. Rajeshwari, do we want to call him and just check with him?
Yes, I'll do that.
Yeah, I think there must have been some. We all have these technical glitches. Otherwise, there are a lot of questions, and I can also begin with them, because very fascinating issues have been raised. But I don't want to lose out to listen to Sheikh. There he is. He's joining in again.
Can you see me now?
Yes, Sheikh. Perfect. Thank you. So please go ahead with your, do you have a presentation? Thank you.
So thank you, Dr. Sunita, as well as our other panelists. So today I'll talk about the implications of this pollution, because as an environmentalist, I consider this AMR issue as a pollution, and we also try to solve this problem considering different key markers of AMR as a pollutant. And if you see worldwide, the scenario is not very different. Obviously, India has huge population, and the AMR issues with India is quite prominent. And when we talk about problem with AMR, we are more concerned about the health sector because it directly affects us. So you can see, compared to any other developed country, in developing country, the problem is more eminent. And for us, it is actually a double burden, because we are still fighting to manage our conventional pollutant like sewage and any other pollutant we generally get or encounter in day-to-day life. And when you talk about this AMR as well as emerging hazards, they create double burden. So in developed country, they have some infrastructure to take care of this double burden, whereas in India and other LMICs, we are still fighting to develop infrastructure to manage conventional pollutant, and also we are suffering from this double burden. Now, we know that different sectors are actually using different kind of connection to contribute AMR in the environment. So Aid has already mentioned about agricultural sector and the pharmaceutical industry. Steve has already mentioned about the pharmaceutical industry. Similarly, in different other sectors where you use these antibiotics like aquaculture or animal husbandry or our health care facilities, there we all use this antibiotic, and ultimately the effluent obtained from all these sectors actually create problem in the environment by either creating stress to the bacteria, so that will create emergence of new antibiotic resistant bacteria. So at the end of the process, we actually get new bacterial strain, which are, in terms you can say, they are all superbug. So one single antibiotic may not be effective to treat them. So when you try to get the bacteria to the environment, if you break the link, or if you just have some treatment option to break the link, then you can reduce the problem caused to the environment by these AMR indicators. So in India, we know we have a huge share in the world population, and we also use a lot of water for our survival. But when you talk about generation of sewage, that factor is also quite significant, because in India, we use or you generate almost 40 billion liters of sewage every day. And also within that, apart from the sewage, we also have almost 13 billion industrial wastewater. So when you compare the volume, obviously the domestic sewage has significant volume. And in our study, we have observed that the sewage is actually creating significant impact on the environment. As a case study, we have selected Delhi region, and we found most of the treatment plant meant for treating the sewage is actually doing certain things which are really good for the environment, but also it is creating problem with the AMR, because most of the treatment plants are actually working like a harboring station, and they increase the pollution rather treating it. So if you see in the state, we have STPs in multiple locations. We have different other prolific AMR sources like hospitals. We have different sewage collecting drains. And when you check the concentration, in hospital, the concentration of AMR indicating parameters like this ESBL or KPC bacteria, their concentration is quite high, but it is not very different from the sewage network as well as STP and river. So final receiving water body is actually having significant amount of AMR preserving bacteria as well as the resistance genes. So if you see the map of entire city, you will find a lot of hotspots, but ultimately at the end, the final receiving water bodies, the river, is actually having significant amount of antibiotic resistance bacteria. And there actually we can have some intervention to reduce the proliferation. So before it gets discharged to the river, if we do some intervention, if we put some intervention, then definitely we can reduce the burden. But in LMIC, our main intention is to have low cost treatment technology. So we have to make sure the treatment technology, whatever we'll use, that should tackle the AMR, and also that will have a little bit less economic impact. And when you have a debate that, okay, hospital is actually creating more burden than the community, that is some substance is there, but it is actually not very true, because when you get hospital effluent, the concentration wise, the AMR indicators are a little bit higher. Whereas when you talk about volume of hospital effluent will not be as high as the sewage. So obviously, even if you have low concentration but higher volume, overall amount will be quite significant in sewage or community effluent compared to hospital effluent. So when you talk about intervention, it is always easy to choose certain things which will have more impact. So if you try to treat our sewage, then definitely we can reduce the burden substantially. And unfortunately, in India, overall countrywide, we have only infrastructure to capture 30% of sewage. So remaining 70% sewage get discharged to the surface water bodies, without getting any treatment. So obviously, if you have an intervention to reduce or treat the sewage, then you can have substantial improvement in the environment. So typically in sewage treatment plant, we use some secondary treatment system, which are mostly biological in nature. And then we also try to have some tertiary treatment unit for disinfection purpose. Now, the secondary treatment units are actually designed for removing different nutrients and suspended solid. So they are not designed or not capable of removing this emerging contaminants like AMR. And in tertiary treatment technology, when you use disinfection treatment option, there you can get reduction of the bacteria. But when you talk about reduction of antibiotic resistance gene, then these treatment options are actually not very successful. And if you see the situation in some other areas where you expect pollution load will be less, like in pristine site or upstream of river where anthropogenic activities are not very prominent, so you expect the pollution level will be less. But unfortunately, if you have huge gathering in a given area, although that site is very pristine throughout the year, but in a particular season, if you get huge gathering, the simple excreta, human excreta can actually pollute the river significantly. And that's why I'm giving a comparison. We all know that river Yamuna is very polluted in Delhi. And compared to river Yamuna, Ganga in Rishikesh, Haridwar, that is upstream of Ganga river, their pollution load is actually not that high. But in a given season, when you get a lot of pilgrimages in a particular location, the pollution level is actually almost comparable with Delhi. So Ganga and Yamuna river will not have huge difference if you have huge amount of footfall in a given time. And major problem to have this issue is actually not having proper treatment system to capture the sewage or capture the human excreta. So even if you have very simple intervention, like this conventional secondary treatment options without having any sophisticated tertiary treatment system, still you can get rid of this pollution problem by just installing some temporary toilets. Because if you just install the temporary toilet and capture this human excreta and keep them for substantial amount of time, like 36 hours of time, the bacterial population present in those excreta will automatically come down, and they're because of that.
Sheikh, I'm going to ask you to wrap up now. I have a lot of questions, so I want to take those. So if you have a few more slides, I will wait. I will, please go ahead.
Okay. So different options are there, and within that, the tertiary treatment options are actually not very effective to remove ARG. We can get substantial reduction of bacteria, but not the gene. So that's why we are talking about some membrane-based treatment technology and also some specific adsorbent which will remove the ARGs and give you clear water. Now, final question is whether we will go for those kind of treatment system, because most of the cases, those treatment options will not be very cheap. So you have to think whether you will go for this cost of life. This is a completely different perspective you have to think of. And also when you talk about world without boundaries, because if you have some good treatment options in a specific country, but contamination of AMR will not be contained in a specific environment, it will have significant movement among different countries. So even if you think that your country is safe, having different good treatment options, still it is not safe unless you help the other LMICs to improve their establishment. Thank you.
Thank you, Sheikh. Thank you. I want to keep some time for questions, and I will come back to all the speakers to ask for their views. The first issue that has come up is from Phil Taylor, which is really about farms to the environment. Are you including the crop sector? Very important question. Is the crop sector also part of the problem of waste and environmental contamination? Amit, would you like to take that? Rajeshwari?
Yeah, Rajeshwari, please go on. Yeah.
Okay. So just to answer that, I would say that definitely that the crop sector has a role, of course, when it comes to the environmental AMR aspect. When we were doing our bit of research, trying to understand how this influences the environment, what we came across is that the antibiotics are sprayed on the crops, or antimicrobials are sprayed on the crops, and there is a section of the unspent antibiotics which are being sprayed that goes unused and finds their way into the larger environment, into the soil, and then into the larger water bodies. So I would say there is definitely a linkage which needs to be explored and talked about.
Thank you, Rajeshwari. Ed, would you like to take this? Are there any implementable policies for the prevention of AMR use in livestock, high-valued farm crops, and shrimp fish in the South Asian countries? So I will come to you. And then I know that Amit and Rajeshwari have also looked at aquaculture. So I will come back to them. Ed, please.
I would say in general, the strategy is to reduce antimicrobial use, which means keeping fish, animals, poultry healthy by other means, whether it's deployment of appropriate vaccines, nutritional strategies, ensuring biosafety, ensuring good hygiene practice. The objective has to be reducing AMU. I think the other part of this that needs to be kept in mind is that the way that will be accomplished will be very different according to the particular circumstances of where the producer is, where the farmer is. So issues of the business model, what kind of particular disease challenges the person's facing will influence what makes sense for that particular setting. In the crop realm, really it's going to be breeding resistance and a constant race to breed resistance versus using fungicides or antibiotics. I'll leave it at that. Thank you.
Thank you. Rajeshwari, would you like to add the aquaculture work that you did, and what do you see as some of the policies and guidance that needs to come up?
So I think I can talk from the point of view of aquaculture study that we did in one of the states in India. And of course, we did highlight from the practices that while antimicrobials were being used in aquaculture ponds, the way the water needs to be treated was something that needed more attention, and from the point of view of removing antimicrobials. The policy that we have in place right now is the coastal aquaculture guidelines that reflects largely about the coastal aquaculture or the shrimp aquaculture. But there is also a large section of the freshwater aquaculture that is there in India, where also fish is being cultured, carps largely are being cultured, for which we do not have a direct policy. And when I was looking at it yesterday, of course, the guideline that we have talks about wastewater management. There are wastewater standards when it comes to managing effluent from an aquaculture farm. But then, of course, it is the standard parameters like the pH, the BOD, the COD. So we have the standard parameters, but not from the angle of AMR, but it does talk about proper farm management, proper waste management, and all of which can be done to, in the first place, reduce the need for antimicrobials. But again, like I said, it's applicable to the shrimp aquaculture or the coastal part of the fish rearing that happens, and not the freshwater aquaculture here in India.
But this does mean, and I think we should work on it further, I think there is a clear need because it is a major livelihood and an economic activity in our world. So I think both aquaculture, and we know its use. We do know in India there are a lot of standards because of the concerns of antibiotic resistance that have come from the European Union, where a lot of these shrimp are exported. So there are standards, there is checking, and there is efforts to work on preventive use rather than using antimicrobials. But I think clearly that is an area, and I think we could flag it as an area that we should work on further, given that there is a great interest in this. Amit, Deepak, would you like to add to this? Any point?
So just to add to what Rajeshwari mentioned, I think from the perspective of livestock in Southeast Asian countries, we know that quite a lot of countries have actually banned colistin. In India also it's the case. So colistin can no longer be used. That's one. Then a couple of countries have also have made some restrictive controls on growth promoter use. And that basically overall adds to the fact that some amount of or some kind of antibiotics are now not allowed, and therefore the misuse is avoided. Having said that, we of course have to see how much of that is implemented. In India, we have a ban on colistin, yes, but we are yet to have a ban on growth promoters. That's the India scenario.
Thank you, Amit. So let me take the next question, which I think I would like to bring in Steve and again bring in Rajeshwari and also bring in Sheikh into it. And I want to spend some time discussing it because the next question is really about pharma industries who have zero liquid discharge and solid waste for co-processing. And if they don't have, then what is the guidance that is available? And according to this person, we have a number of antibiotics being manufactured, and what then are the way ahead? Now, from the research we are doing, Rajeshwari, correct me if I'm wrong, and I'd like Steve to come into this as well. Our research is showing us that there are two kinds of control measures that pharma industry is putting into place, two regulatory approaches. Let me put it that way, Steve, because the Alliance has worked on voluntary standards, but for CSE, the issue is that we do want standards, but obviously we want standards which can be implemented. We do also want to see what are the strengthening of the regulatory systems that would ensure compliance. Now, from our research, we are finding that there are two kinds of pharma industry regulations that are in place in India. And I would imagine that are in place maybe in other countries. And Rajeshwari has done this paper, and we're hoping to launch it very soon with discussions with industry as well. So the first is a very clear provision for zero discharge. Now, this is for large industries where there is a provision that there is a zero discharge regulation, which means that recycling, reuse of all water effluent is required by law. Now, we are looking into, and our discussion with the pollution boards is, how do we improve the enforcement of the zero discharge? How do we improve the compliance of zero discharge? And with industry, our discussion is, how do we ensure that there is better processes to make sure zero discharge happens, internal processes. The second regulatory is for smaller industries who have to send their waste to common effluent treatment plants. Now, all pharma industries which are below a certain size are required to send them to CETPs. Now, again, for us, the question is that in the CETP, after treatment, what is the evidence that there is contamination still, or there is evidence of antibiotic residue after treatment? And if that is the case, what further needs to be done at the CETP level, or what further needs to be done at the industry level? So that's really the two areas that we are beginning to look at. And that's really where I think the whole discussion on how to move ahead we would like to see it. Have I paraphrased your work correctly, Rajeshwari?
Yes, Sunita, rightly mentioned.
Took the time to do so, because I think it's fascinating, and I'm hoping that you will release it soon. But Steve, from this and from this question, how does the industry look at this then?
Well, we could probably spend another hour talking about this topic, so I'll have to be brief. But first of all, let me talk about CLD. So CLD is great where you have it, but it's not the complete panacea for everything. So, I mean, even we have found when we assess our manufacturing sites, our supplier sites with ZLD in place, that you can still have release of antibiotics into the environment. So, for example, you need to make sure that all relevant waste streams are tied into your ZLD. If they're not, then you could have antibiotics being released into the environment. You need to have the programs for planned maintenance that account for what happens when the ZLD is down, and you need to make sure it's not being pumped under and over a wall on the factory, for example, while the plant is down. So yes, ZLD does work if it's designed properly, sized properly, operated properly, maintained properly. And in fact, in that regard, India has a step up on many other countries because I'm not aware that there are ZLD requirements in other countries. For example, a significant amount of API production takes place in China. I don't think they have those similar mandates. Now, to come back to the other question, I mean, India has a lot of drug product manufacturing formulation. I mean, you would say on paper that the risk is lower with drug product manufacturing because it's a different kind of process. However, you're handling a lot of powders and dusts, and they can very easily be washed down the drain, and then so you're in your wastewater system, and it ultimately depends on how that wastewater system is treated, as to what concentration of antibiotic gets into the environment. So here, we believe that setting these predicted no effect concentrations and working, if you like, backwards to ensure that you can adhere to them are important. Now we've set our numbers based on what we believe is the best available science at the time we set the numbers, which is they're based on minimum inhibitory concentrations of antibiotics, from the published literature. And in fact, actually, we also consider ecotoxicity, nothing to do with resistance, but if the more traditional ecotoxicity data show a lower number should be applied, then we'll use the lower number of the two. And that does occur in some cases. Some compounds have other ecological properties that are more concerning than antimicrobial resistance, and we want to make sure that we don't overlook those concerns as well. Now, there's a debate around, what is the pollutant? Is the pollutant the antibiotic, or is the pollutant some mobile genetic element, some antibiotic resistant gene that could result from the presence of antibiotics with bacteria? To the best of my knowledge, there's no scientific data that really allows you to determine the risk from antibiotic resistant genes. So working that backwards, there's no way to set currently, I don't believe, any kind of control limit based on the potential presence of antibiotic resistant genes per se. So we are controlling based on the concentration of antibiotic that we believe will not result in an increased selection pressure on the bacteria in the environment. So that's how we have approached our work. That's what we're doing. Our concentrations are in the orders of parts per billion in the receiving water, which is, in our opinion, very low concentrations, especially when you consider that there are many other sources of antibiotics in the environment as well. So that's what we're striving for. I agree with you, especially in India, given the magnitude of the issue, that regulation would be helpful. I don't see it as quite the panacea that you do, that once it's in the regulation, it's definitely going to be applied and enforced. I think you've got a whole series of questions around the ability to equitably enforce any kind of controls that you put in place that would need to be addressed. But the Alliance, just to be very clear, the Alliance did support the proposed, the concept of the proposed regulations that were put forward in India that included discharge limits for antibiotics. We did also, during public consultation, comment on the need for those limits to be, the rationale for the limits to be clear, because the rationale was not included in the publication of the proposed regulations. And they were different from the numbers that we use, and we couldn't understand the scientific basis of the numbers that were proposed. They were orders of magnitude lower than our already very low numbers. So we did indicate and point to our PNECs and the scientific rationale for our PNECs. So that's probably as much as I could say at the moment, but I suspect we could have a debate for a good hour around this topic.
We will continue to do this because we also believe that the regulatory standard needs to be backed with a lot more ability to understand how practices currently operate and the current regulations, both in terms of it as I said, the ZLD and the CETP. How can we improve those practices before we move into just a new regulatory standard? And that's really where we want to engage to understand this better and work to get industry also to explain and work with us on this. So that will be an ongoing work for this year, and we will.
That's great. And we speaking on behalf of the Alliance, we'd be more than happy to continue the dialogue with you.
Good. So we will come back to you on that, Steve. Sheikh, do you want to add anything on this issue of ZLD, if you have done any work? And my specific question, Sheikh, is really, so as Steve said, ZLD is there, but we know that there are many loopholes in it, okay? But the point that we have is, how do you improve the compliance, the monitoring and enforcement of ZLD? And how do you improve the processes in industry so that ZLD becomes more effective and does not lead to contamination or bypassing the system? I don't know of the pharma industry, but I do know that ZLD in many other industry has meant that you bypass the system and you pump it into the groundwater, which is disastrous. So I think that's a big area for, but if you have any comment on that, that'll help.
So you rightly mentioned ZLD we have on book, but actually when they talk about practicing ZLD in different pharma industry, they are not behaving differently than any other common industry. So a few good industries, they are following good manufacturing practices. So they are using some process which will actually ensure lower production of different antibiotic residues, whereas most of the small companies, when they send their effluent to CETPs, it is very difficult for the CETP to have a dedicated system which will take care of the low concentration of antibiotic. And when you talk about infrastructure development, even in the pollution control authorities, they also don't have that kind of setup to monitor very low concentration of those pollutants. And in a given environment, when you have multiple residues at a very low concentration for prolonged exposure, it will actually generate different resistance strain, and the proliferation through the novel resistance gene is not deniable. It is always there, and it will be there unless we restrict the introduction of different resistance creating agents like antibiotic or any other pollutants. So implementation of ZLD or saying that system is complying with ZLD is very easy for the regulatory authorities, because they will say monitoring is not required because industry is not discharging any water. So when you classify any particular industry complying with ZLD, then the implementing authority can actually say that as company is complying ZLD, we don't have much to monitor. But it should be other way around. You have to have proper infrastructure to check whether they are complying with ZLD. And unfortunately in India, it is actually not being practiced.
No, but that's what we want to work on, and we will work both with the Pollution Control Board and with industry, because instead of replacing that regime, it would be good to make that effective. And that's really what something that Rajeshwari's paper has brought out very clearly. Rajeshwari, anything you want to add to this discussion?
I think a lot of valuable points have been added, but very quickly, when I see the question, there is a word called hopefully, whether zero liquid discharge addresses AMR. The answer to it is it's a possible yes. I'm not a technical expert, but I understand that there is a lot of multiple effect evaporators and a lot of thin film drying happening and incineration happening. So possibly no residues will remain. So it should take care of the residues that go into the effluent. But again, like Steve and Zia have been discussing, the implementation, whether on the ground it's actually happening or not, is a concern. When it comes to those who do not have ZLDs, of course, it lands up on the responsibility lands up on common effluent treatment plants. Our interaction with small and medium scale players indicate that they do pay these CETP facilities to take care of their waste. So it's more the more effort has to come from the CETP when it comes to managing or monitoring AMR determinants in the environment.
No, absolutely.
Yeah.
Thank you.
Can I just want to emphasize that within the Alliance, it's, we believe it's critically important that on the ground auditing takes place of all antibiotic manufacturers, irrespective of whether they have ZLD or not. And especially with ZLD, for all the reasons I've said, we don't just take for granted the fact they've got ZLD and therefore there's no issue. And we have examples of where, companies have had problems, even though they've got ZLD. So, it can work well, but it requires a number of things to be in place and maintained. So that is a concern. And then when you get to your common treatment plants, I mean, that's where this whole thing started with, Pat and Sheru, and there are very high concentrations of antibiotics being measured by Dr. Larson's research group at the back end of that common effluent treatment plant at Pat and Sheru in Hyderabad. So again, the wastewater treatment plants need to be sized properly to receive the waste that they are receiving. And there's a number of parameters that they may put in place, for companies that are sending their waste there. They may or may not include anything to do with antibiotic resistance, but sometimes some of the other parameters will act as a bit of a surrogate to, control the waste flows in. But again, you're right, that is an area of concern.
Absolutely, Steve, and it's something that we will pursue because something that we believe is an area, an agenda to work to make sure that we work both with industry and with regulators to find the right mix and to find the right ways to be able to move ahead on this. So we will do that. Let me take one or two more questions before I wrap up. One is a question about the expired, the disposal of antibiotics which are past expiry date. I mean, we haven't discussed that today, but it is a waste issue. So let me take that as one of the last questions. Who would like to jump into this? I will leave it to anybody from the excellent group of panelists, including Amit and Deepak. Anyone wants to jump into this? I'm happy to hear from you on it. What is the mechanism for disposal of antibiotics which have passed expiry date? Amit?
Okay, so clearly there are a lot of drug take back programs that we know in primarily in the developed parts of the world. We also know that they are tied up with something called as EPR, which is called Extended Producer Responsibility. These are through different ways, through different mechanisms, these are operated. Ultimately, the point is that producer is responsible for handling that waste. That's one. We know that in the countries of the global south, this is not really happening. However, some countries may have some legislation, but for India, for example, we know that yes, at a very high level, there is some bylaws of the municipal waste wherein segregation takes care of it. There is a law on the biomedical waste that also takes care of it. But of course, implementation is a concern.
No, implementation is a concern, but also, Amit, I mean, hospitals do have rules in terms of expired medicines. And we do have systems now in the waste systems. We are building in systems of sanitary waste collection, the yellow bags in municipalities. So you could come in because it's an incineration issue. It's a matter of collection and incinerating. So again, within the solid waste management rules, it could be a solution to work through. I think there are approaches here that we could use which are available for the environmental management of waste. And that's really where we need to explore. So let me ask Ed and Sheikh if they have anything to add, as I have not had Ed to speak too much. So Ed, I give you the floor now before I will actually wrap up.
I guess the one thing I would say is respond to one of the questions that I saw in there, which had to do with companion animals.
Yes.
And people wondering whether antibiotic use by their family pets is an issue or not. I think the way to think about that is to consider a family pet essentially as one of your children, as a sibling of your children. the care that you will give that pet would be similar, and the concern that you would have for it would be similar to what you would have for your child. And thus the antimicrobials they would receive if they have an infection would sort of be managed in the same way. At least that's the way it's been explained to me by my veterinary epidemiology colleagues. So I'll just leave it at that. And thank you once again for the invitation.
No, thank you. Any of the other panelists, last words before I wrap up?
Yeah, just I know that some of the questions have not been answered.
Yeah.
Would it be possible to answer the questions after the session through email to the people that have asked the questions? Do you, if you send the questions, can we answer them, and can you send them back to the participants?
Thank you, Steve. That's a wonderful idea. Rajeshwari and Sukanya, is that technically possible? When I check out of this, do the questions disappear, or do you get to keep them? I actually don't know.
Yes, ma'am. We'll have all the backup.
We'll have the backup. Fine. So then, Sukanya, I think the best would be to see if send the questions to the panelists and see if there's any answers that they could give. There will be emails to these questions as well, right? To the person who's asked the question. So
Yes, ma'am.
sorry
Yes,
to
ma'am.
ask such basic questions, but
Yes, ma'am. We'll have all the database and we can share it with the speakers.
So thank you, Steve. Thank you for that suggestion. Thank you. That's a wonderful suggestion. I mean, we never get through to all the questions. We have an amazing, we've had, I mean, I am really very amazed, Rajeshwari, Amit and Deepak, that you have got a huge, you've got a good number of people joining us today. Today is the last day of the Antimicrobial Resistance Week. There are huge numbers of meetings happening across the world on this, and you have an outstanding panel to discuss a very critical issue. So I think we've had a very good discussion. Clearly, the issue of environment and AMR requires us to work very closely, both with industry, the regulatory part of the system, not just to make new standards, but to ensure that that the regulations that exist can actually work better. And then look at what more needs to be done. We also need to look at technologies, and that's where Sheikh, thank you very much for the comments and for your presentation, because clearly for us, the tertiary treatment technologies, which is what then comes into play when you have very high, when you have antimicrobials and very small, tiny chemicals to deal with, are very, very expensive. For a country like India, where we are still struggling to do sewage treatment plants using primary, secondary, and now FSTPs, where our major concern really remains still E. coli and pathogens, whether we are ready to move towards this next level of very expensive technology, not just in India, but across Africa, across the world, because this is really about the excreta that we have from households, what we get from hospitals. So it's a very major area of both understanding the problem, but then finding solutions that don't destroy our very work to remove one of the other determinants of AMR, which is dirty water. Because the whole idea with treatment is that you can actually treat the water and you don't have to, and that will remove the need for increased use of antimicrobials. But if we don't treat the water because we're concerned with the discharge of antimicrobials, it'll work against us. So we need to find an optimum solution that'll work for both. And that's really going to be the next area. Ed, thank you very much for your presentation. Fascinating. I think the whole issue of animals and food producing animals in particular is going to be very important because it is a mainstay of our livelihood, of our economies, of very poor people, and yet we need to produce without contamination. And that's really where the whole issue of looking at the waste and looking at what we can do to reduce it is going to be very important in the months and the years to come. Rajeshwari, thank you very much. Fascinating presentation, good overview in terms of where, what are the concerns. And obviously you have also spelled out what is our agenda going forward. And our research will continue in this. This is the AMR week, but the AMR week is only a way to highlight the issues and bring them to public discourse. Work continues. Amit, Deepak, thank you again for the work that you do and you will continue to do. I think it's very important that we keep the pressure on because these are issues of global importance and it is a silent pandemic, but it is a pandemic that we can't afford to lose. So thank you very much once again, everyone, for joining us. And again, apologies for not being able to take all the questions, but fascinating discussion. So I think we have learned a lot and we will take this agenda forward. Thank you.